Welcome to Truth Behind History. If you've ever wondered how people in the Middle Ages managed to survive diseases, injuries, and infections without modern medicine, you're in for a wild ride. Today, we're diving into the bizarre, sometimes horrifying, but surprisingly effective world of medieval medicine. Now, when we think about medieval medicine, the first things that come to mind are probably leeches, bloodletting, and a whole lot of superstition. And you wouldn't be wrong. The Middle Ages were a time when medical practices were deeply rooted in mysticism, religious beliefs, and a very limited understanding of science. But despite the oddities, some of these treatments actually worked and even paved the way for modern medicine. In this video, we'll explore some of the most fascinating medieval medical practices, from balancing the four humours with bloodletting to using maggots for wound treatment. We'll see why some of these methods, despite their crude appearances, had real scientific merit and even remain in use today. So buckle up, because this is going to be a journey through history that's as strange as it is enlightening. Let's begin. One of the most well-known and widely used medical practices of the medieval period was bloodletting. The idea behind this method was rooted in the ancient Greek concept of the four humours: blood, phlegm, black bile, and yellow bile. Medieval doctors believed that illness was caused by an imbalance of these humours, and the best way to restore balance: drain some blood. This could be done in several ways. Some methods involved cutting open a vein and letting the blood flow freely, while others used cupping therapy, where a heated glass cup was placed on the skin to create suction and draw out what was considered bad blood. And, of course, we can't forget about the famous medical leeches, which were used to slowly extract blood in a controlled manner. Now, while this may sound barbaric, bloodletting wasn't entirely useless. In fact, in small doses, it could actually lower blood pressure and relieve conditions related to excess iron, such as hemochromatosis. Even today, controlled blood donation is used as a treatment for iron overload. And speaking of leeches, they are still used in modern medicine. Today, medicinal leeches help with microsurgeries, promoting blood circulation and preventing dangerous clotting in reattached limbs and grafts. So, while medieval doctors may not have understood the true science behind it, they accidentally stumbled upon something that still has medical value today. Alright, moving on to something even more intense: drilling holes in the skull. Yes, you heard that right. Let's talk about trepanation. If you thought bloodletting was extreme, wait until you hear about trepanation, the medieval practice of drilling holes into the skull. Believe it or not, this was actually one of the oldest forms of surgery in human history, dating back thousands of years. Why on earth would someone do this? Well, trepanation was commonly used to treat head injuries, epilepsy, and even mental illness. The idea was that by creating a hole in the skull, the doctor could relieve pressure on the brain and release whatever evil spirits might be trapped inside. Sounds terrifying, right? But here's the shocking part: many patients survived. In fact, studies of ancient skulls show up to 80% survival rates, which means medieval doctors must have had at least some level of skill. And if you think this practice is completely outdated, think again. Today, we have something called a craniotomy, which is essentially the modern version of trepanation. Neurosurgeons perform this procedure to relieve pressure from swelling in the brain after traumatic injuries. Of course, it's done with sterile tools and anesthesia rather than a chisel and hammer, but the principle remains the same. So, while medieval surgery might sound crude, some of it was surprisingly effective. But if drilling into the skull sounds bad, just wait until you hear about what they used leeches for. Leeches, the tiny, slimy creatures that are the stuff of nightmares, were actually a staple of medieval medicine. People believed they could cure everything from fevers to headaches and even infections. Leeches were mainly used for bloodletting, as they provided a more controlled way to remove blood compared to cutting open a vein. But what medieval doctors didn't realize was that leeches actually had a secret weapon: their saliva. Leech saliva contains natural anticoagulants, which prevent blood from clotting and improve circulation. This made them useful in treating conditions where blood flow was restricted. And here's the crazy part: leeches are still used in modern medicine today. In reconstructive surgery, leeches help restore circulation to delicate tissues after grafts or reattachments. They might not be as widely used as in medieval times, but their medicinal benefits are undeniable. Now, if leeches didn't work, medieval doctors had another trick up their sleeve: honey. Yes, honey. And no, not for tea, for treating wounds. Believe it or not, one of the most effective medieval remedies wasn't some gruesome surgery or bloodletting technique, it was honey. That's right, something we put in tea today was actually a powerful medical tool in the Middle Ages. Medieval healers applied honey to wounds, believing it could prevent infection. And unlike many medieval treatments, this one actually worked, not by magic, but by science. Honey contains hydrogen peroxide and natural enzymes that kill bacteria, making it a natural antiseptic. It also has a low water content, which means bacteria struggle to survive in it. This made honey one of the best options for wound care in an era where antibiotics didn't exist. And guess what? Honey is still used in medicine today. In modern hospitals, medical-grade honey is applied to burns, ulcers, and antibiotic-resistant infections because of its incredible healing properties. So, while medieval doctors got a lot of things wrong, this was one they actually got right. But not all medieval wound treatments were so gentle. If honey didn't work, there was always the more extreme option, burning the wound shut. Imagine you're a medieval soldier, wounded on the battlefield. There are no antibiotics, no painkillers, and no sterile operating rooms. What's the best way to stop you from bleeding out and getting a deadly infection? Fire. Yes, one of the most painful but effective medieval medical treatments was cauterization, burning the wound shut using heated metal. The extreme heat would seal the wound, stop the bleeding, and kill bacteria, reducing the chances of infection in an age when even a small cut could turn fatal. This method wasn't just for soldiers. Medieval surgeons used cauterization for all kinds of injuries, infections, and even amputations. It was excruciatingly painful, but in some cases, it saved lives. And here's where things get interesting: we still use this concept today. Modern medicine has developed electrocautery and laser surgery, which use heat to sterilize wounds, stop bleeding, and prevent infections, just like medieval cauterization, but with way more precision and a lot less pain. But if you thought cauterization was extreme, just wait until you hear what they used maggots for. Maggots. Tiny, wriggling larvae that feast on dead flesh. Sounds like something out of a nightmare, right? Well, in medieval times, these little creatures were actually used as a medical treatment, and believe it or not, they were incredibly effective. Doctors and battlefield surgeons would place maggots on infected wounds to eat away the dead, rotting tissue. This wasn't some twisted experiment, it actually helped prevent gangrene, a deadly condition caused by infected, decaying flesh. But here's the crazy part: modern medicine still uses maggots today. In fact, FDA-approved maggot therapy is a real treatment for chronic wounds, diabetic ulcers, and severe infections. Maggots only eat dead tissue, leaving the healthy tissue untouched, which helps speed up healing. So, while the idea of maggots in medicine might make your skin crawl, this is one medieval practice that turned out to be surprisingly advanced. But medieval doctors didn't just rely on creatures to diagnose illness, they also used something a bit more personal. You might not want to hear this, but in medieval times, doctors didn't have fancy lab tests to diagnose diseases. Instead, they had a much simpler, and far more disgusting, method: analyzing urine. Yes, urine was basically the first laboratory test in history. Doctors would carefully examine its color, smell, and even taste to determine a patient's health. If urine was dark, it could mean dehydration. If it was sweet, it could indicate diabetes. And if it smelled foul, it might signal an infection. Now, before you laugh too hard at medieval doctors for tasting urine, consider this: they were actually onto something. Urine does reflect metabolic and organ health, which is why urinalysis is still a crucial medical test today. Doctors now use urine samples to detect kidney disease, diabetes, infections, and more, just without the tasting part. So, as strange as it sounds, medieval doctors were laying the groundwork for modern diagnostics. But one of the most important contributions of medieval medicine wasn't just about testing, it was about quarantine. During the Black Plague, one of the deadliest pandemics in history, medieval doctors had no idea what caused the disease. They didn't understand bacteria, they didn't understand viruses, and they certainly didn't have vaccines or treatments. But they did come up with one strategy that actually worked: quarantine. Infected individuals were isolated for 40 days to prevent the spread of the disease. The word quarantine actually comes from the Italian term 40 giorni, meaning 40 days. Now, did medieval people know how quarantine worked on a microbiological level? No, but they did notice that it helped contain outbreaks, unknowingly following the principles of infectious disease control. And of course, quarantine is still a critical public health tool today. We saw it used during the COVID pandemic, Ebola outbreaks, and other modern health crises. So, while medieval doctors didn't fully understand why quarantine worked, they knew it was effective, and it remains a key part of medicine today. But what about medieval herbal medicine? Were plants just used for decoration, or did they really have healing powers? In the Middle Ages, people believed that nature had hidden clues about which plants could heal which illnesses. This idea was called the doctrine of signatures, and it was based on the belief that plants resembling certain body parts could treat related ailments. For example, walnuts, which look like little brains, were thought to improve brain health. Liverwort, a plant shaped like a liver, was believed to treat liver diseases. And lungwort, with its spongy, lung-like appearance, was used for respiratory illnesses. Now, while a lot of this was pure superstition, some of these remedies actually worked. Many plants do contain medicinal compounds that can benefit the organs they were believed to heal. Today, modern science has confirmed that certain herbs and plants do have therapeutic properties, and herbal medicine is still widely used. So, while medieval people may have been guessing, they accidentally discovered some real medicinal benefits. But what about medieval surgery tools? How advanced were they? Medieval surgeons may not have had modern hospitals, but they did develop tools that are still recognizable today. Instruments like scalpels, forceps, and bone saws were designed for battlefield medicine, amputations, and wound care. Many of these tools had lasting designs, meaning they've barely changed over the centuries. Sure, today's surgical instruments are far more precise and sterile, but their core functions remain the same. Advancements in sterilization, anesthesia, and precision techniques have improved surgery dramatically. But at the end of the day, medieval surgeons laid the foundation for modern medical procedures. Alright, we've covered a lot, but what's the final takeaway? Let's wrap things up. As strange and brutal as medieval medicine was, some of its practices had real scientific merit. Quarantine, bloodletting, herbal remedies, and even maggot therapy all played a role in shaping modern medicine. So if you found this video interesting, make sure to like, comment, and subscribe to Truth Behind History. And if you love learning about the weird, wild, and often shocking past, check out my other videos. See you next time.